A significant percentage of children will have wheezy respiratory illnesses, and from the age of around 12 to 14 months, many of them will respond to short-acting beta agonists. It is difficult to give this to some children because they're upset about how it is done, but using the right technique is extremely important, as much as using the right medication. In this case, we're using placebo to demonstrate this. The best way of doing this is to show the parent how to do this yourself. And so what we're going to do, we have Audrey here. So Audrey, we're going to have a really cool hug, okay? This is where I'm going to give you a big hug, and we're going to put this over your face like this. So what happens is, you come with me. That's the way. Yeah, that's excellent. We're going to have a hug. So luckily Audrey is very compliant, but sometimes you have the other toddler who will not be happy about this, and you'll have to show them how to do this. Her legs between your legs. The arm is fine, perhaps behind here. And then you gently hold her quite firmly so that she's unable to escape, so to speak. This is between thumb and forefinger and placed over here. Before we do that, it needs to be primed. And then this is placed over there. And there's a nice tight seal. And then there's a few big breaths, 3 to 4 breaths with each puff. And for a child under the age of 6, you're looking at 6 puffs for the child who's having significant breathing troubles, and for the child between the age of 6 and 12 years, you're looking at 12 puffs. And that's the equivalent of the nebulizer. That's excellent. We can do another puff while we're sitting here. And so we do 3 to 4 puffs, 3 to 4 breaths with each puff. The child that's crying and upset, I tell parents that helps the short-acting beta agonist get into the airways and helps dilate them. You've done really well. That's fantastic. Hop back. Well done, Audrey.